research director for Lipodystrophy United. It's a patient advocacy organization in the US, but it's also an umbrella organization for other lipodystrophy advocacy teams around the world. And I am a patient myself. I have familial partial lipodystrophy type 1. I was diagnosed a year and a half ago after about 27 years of searching for a diagnosis. I'm a cancer researcher, and now I'm doing lipodystrophy full-time. So I had signs and symptoms of insulin resistance and lipodystrophy since I was 6 years old. I've been searching for the diagnosis. I went to 11 endocrinologists to try and find the diagnosis. They all thought I had Cushing's disease and just did all the tests for Cushing's, but every test came back normal. Until at the age of 28, I was diagnosed finally with diabetes type 2, and this accelerated my diagnosis path into lipodystrophy. A year and a half ago, because of my diabetes diagnosis, I was searching for an endocrinologist who can write my whole diagnostic history to get my disability. And I went to the first endocrinologist I could find on Google. And she was the only one who did a physical examination on me, which means taking my shirt off, taking my pants off, and really see my body composition. And she immediately knew I had lipodystrophy. That's how I got the diagnosis, and this is something that patients with lipodystrophy usually experience. Just someone who sees them without any clothes on, or like with short sleeves, short pants, and see our muscular features, and just know that it's lipodystrophy. I, as a patient, experience a lot of different symptoms that are related to pain, mental health struggles. We have low body image. So I think for patients, it's important to know that our physicians know that we are compliant with treatment, that we are trying our best. It's a very complicated disease, very complicated treatment. So the burden of the disease is very, very high on us. But we are really compliant with treatment, diet, whatever they want us to do. But just because the disease is so hard and progressive, they may be not seeing that change with treatment, and that it's not our fault. We are trying to do our best, and they should behave like we are trying to do it, because sometimes we feel like they think we are not compliant, so they don't want to treat us as well, but that's not true. That the burden of the disease is so high. It's a multi-system disease, which means that every system in our body is affected by the disease. So we need to take a lot of different medications. We have pain all over, and it's very hard to live normal lives with the disease. So just to know that they need to check not just our metabolic functions like our A1C or other blood tests, they need to ask about our mental health as well, and how are we feeling as a human, and not just someone with diabetes or other problems. Find our community. For me, just finding other patients and talking with other patients was life-changing. Just being with other people in the same room, or even in a Zoom call, and hearing about their problems, and just realizing that we all have the same diagnosis and diagnostic path. We share our symptoms. It just made me feel so much better with myself. And just hearing that we do have patients who get the right treatment just led me to go and find people who can treat me. So just sharing information with other patients as well. I think just because it's such a rare disease, just finding other people, finding your community, educating your family about the disease, so getting some resources and educating your family, friends about the disease will help patients a lot. Get educated yourself, find the information online, ask your physicians about more information. The more knowledge you have about the disease, it's easier to control it, and just find your people.